Hello, hello, hello. How's everyone doing? So, see what we got here. It says here, woman who reported mistreatment while giving birth says CDC report validates trauma. Yeah, she spoke her truth, and apparently the CDC agrees with it. Uh, she delivered a healthy child, but said she left the maternity ward traumatized and ashamed. You should be. Your insides were all hanging out, and baby came out of you. There was pain and blood, and I would be traumatized and ashamed. The most happy moment in my life is at the same time the most terrible moment in my life because of what they did to me. Oh man, what did they do? Said a California mother who alleges hospital staff physically restrained her against her will. Yeah, well, yeah, they usually they usually do that against your will if they're restraining you, and coerced her into accepting interventions to expedite her delivery at the hospital last year. Well, if they're the medical professionals, they would probably suggest something that would help save the child. And considering your baby was born healthy, I would assume that they were right. Is it coercion? I mean, they know what you don't know. I don't know, man. I don't believe any of this yet. Maybe there's some evidence. I mean, the CDC agreed with her. I said, no, I don't want to. I'm full of energy. It's an awfully calm thing to say for a pregnant woman about to give birth. In my experience, pregnant women are very erratic, especially when child is about to come out. They crush your hand, your hopes, your dreams, and then they have a baby. Said the woman who spoke to ABC News only on condition of anonymity to protect her family's privacy. Well, you ain't suing nobody, and you ain't saying who you are. Something, and you're lying. Because I'm pretty sure you would want to say who you are to get that money from the hospital, unless you were lying. I said, no, nobody cared. Well, they weren't doing anything untoward. This patient is one of the, okay, some women reported mistreatment during maternity care. This patient is one of the growing number of women who advocates say are challenging a culture of silence and stigma around mistreatment during pregnancy and birth. Well, they're not exactly in the right condition to really actually evaluate things correctly, right? And usually when they're going through that, there's usually like someone there with them that's not actually going through all that pain and any of that stuff, and they can actually evaluate the situation correctly, right? Unless you're just going off of their experience and their feelings, then that's really dubious. The Centers for Disease Control and Prevention says the experiences are not uncommon and may contribute to the nation's maternal mortality rate. Really? Because I'm pretty sure the Centers for Disease Control aren't really doing an on-ground investigation, and they're most likely just going by surveys. And if these women are just telling one side of the story, and they're all telling one side of the story, then is it really an accurate, evaluation? One of the highest among the richest countries in the world, blah, blah, blah. Earlier this year, the agency launched an awareness campaign with a notice to American healthcare systems to be more respectful in providing maternity care. So what, these women felt disrespected? They're not like in their own private hospital wing. These people are hard, work hard, man. There's emergencies going on. There's all kinds of shit going on. And you're probably most likely in that situation, you're yelling abuse at them. There's no way. ABC News spoke with a number of women across the country who said guidance was overdue. Bro, if anybody has spent any amount of time with a pregnant woman, like, there are terrible people in this world, but one of the biggest assholes you will ever meet in your entire life is a pregnant woman. Like they're just like entitled, just rude, and they have the same excuse. Baby, pregnant. It just, if the CDC has to tell you to respect patients' rights and to respect the medical ethics of autonomy, I think we've really gone off the rails. Really? The CDC would say that to anybody. Said Julie Cantor, a women's rights advocate and attorney who is representing Doe. All right. I don't know what rights were violated. They're restraining her. If a hospital staff has to restrain you, I'm pretty sure you would have won in the wrong. Especially if you're pregnant, you're not going to be moving a lot anyways. You're pretty much restrained already. But if you're doing more than that and they have to physically restrain you, you're probably the problem. The CDC analysis, oh God, words, of the recent survey of 2,400 new mothers included reported cases of ignoring requests for help, probably because they're helping someone else, being shouted at or scolded, probably because they told you the same thing many times and you weren't listening because you're entitled, violations of physical privacy. You're in a hospital, they have to come in and check on you, and they're gonna be seeing your whole cooch. Like, what threats to withhold treatment? You're probably asking for drugs like every 10 seconds, or made to accept unwanted treatment. Okay, are you trying to keep the hospital bill down? The mistreatment is very troubling, says CDC Chief Medical Officer Dr. Deborah. Dr. Deborah? Sounds like a children's entertainer. Deborah Howery? Howery in an interview. This is why we need hospital systems, providers, and communities to really be aware of this, because there are many things we need the hospital systems, the providers, and communities to be aware of it. And then what? What are you going to do? Fire all the nurses? And guess what? Most of those nurses are women anyways. So what are you going to say? Is it misogyny? Ari says the cases of mistreatment are especially concerning at the time when maternal deaths in the U.S. are on the rise, especially among Black and Hispanic women. You think because someone was rude to them, is that what they're passing away out of shame and embarrassment and whatever else that woman said? In 2021, the latest year for which data is available, 1,205 women died of maternal causes in the U.S., with a rate of 32.9 deaths per 100,000 live births. I mean, I already got the other numbers. I don't need this shit. Up to a rate of, Jesus Christ, I'm not remembering these numbers. Stop it. Black and Hispanic women had higher rates in 2021. Probably because they have more children. Did I just solve the case? I didn't even listen to any of your numbers. I just solved the goddamn case. It's probably because Black and Hispanic women are having more children. Potentially, in a stressful moment, there can be unconscious bias that comes out. Oh, now it's a race thing. Okay, from a woman thing to a race thing. This is why we need to be more cognizant of it and make sure that women feel empowered to come forward as well when they're experiencing this. Most nurses are women. So who are you complaining about? The doctors? A lot of doctors are women too. I can't think of the actor she looks like. Is it Gene Kelly? Something like that. I can't remember his name, but she definitely looks like him. Mistreatment in maternity care, while not a new phenomenon, has historically been underreported and unaddressed. Advocates of pregnant persons say some women say they are reluctant to raise concerns with providers, especially after an otherwise successful pregnancy. Probably because the doctors and nurses know what they're doing. Cases are generally very hard to litigate, and they're expensive. So on one of the issues that is cultural damn it, words, that is a cultural phenomenon is, well, if the mom's harmed, but the baby's fine, why is that worth any money? Because the only thing that's harmed on the mother is her feelings, said Cantor. It's a system that's built around moving money, not just fixing problems. All systems are built around moving money. Money is literally the incentive for anyone to do a job. What the hell is your point? In 2016, the case of Caroline Malatesta of Birmingham, Alabama, helped put mistreatment of birthing persons in national. Did this motherfucker really say birthing person? A jury delivered Malatesta a landmark $60 million judgment in her favor after claims of medical negligence and reckless fraud against Brookwood Baptist Medical Center, where she delivered her fourth child, probably because it was in Alabama. After devising a natural birth plan with her doctor that emphasized autonomy and freedom of movement, Malatesta said she was subjected to physical restraint. Probably because her plan wasn't feasible at the moment, and they were in a hospital, and they usually do things in a certain way. You devise a plan with the doctor goes, does whatever, and then something comes up, and then the nurses or whoever, they do something different that's not on your plan. They pulled me to my back, flipped me over, pulled you, okay, down on your back, and then flipped you over. But then why pull you down on your back? Why not just flip you over? Okay. And I remember the pressure on my back being so intense that I lifted my right leg and even pushed against the nurse's hairnet, just trying to fight to get back over. Why? You're just hurting yourself by doing that. What the hell? Pushed me to my back and then flipped me over. The hard part came after, when everything's quiet, everyone goes away, and there's a sense of betrayal. I know that sounds unusual, but you have to put your trust in these doctors, into these people who are supposed to be looking out for your care. Okay, very dramatic, but I just want to know what exactly was wrong with what they did. Were they trying to help you? Did you understand why they were doing that? Like you're leaving out a whole lot of details, and if you're not giving the details, it's because the details don't support your case. The only reason to leave out details is if it doesn't support your case, because you're given a bunch of other details that don't really matter. In the months that followed, Malatesta says numbness turned into debilitating pelvic nerve pain and PTSD. Okay, so she got injured from that, and that's probably why the hospital paid out, because she got injured, and she got injured because she was fighting back. She literally said there was pressure on her back, and she was fighting to get up. How do you think that's going to work? Immovable object, like meeting. Oh my God. All of it taking a toll on her ability to parent and her relationship with her husband. One of the biggest, and this is another thing though. How do you know if that's not like postpartum depression? Like it could just be that. And it has nothing to do with really the hospital. And it just like coincided with your hospital visit. One of the biggest roadblocks is that women feel like, well, if I talk about what happened to me, it shows I'm just selfish because I wanted my birth to be a certain way when I really should have been thinking about the safety of the baby. Yes, that's exactly what I'm thinking. Women have these birth plans because they care about the safety of their babies. Yeah, but they don't know what the fuck they're doing. Complications can happen in childbirth that makes your plan no longer feasible. What if the baby's facing a wrong direction and you have a specific plan that doesn't put that into account. And then they come up to you and they tell you, well, we're going to have to flip you over. And you're like, no, that's not in my plan. And then you start fighting them. The jury decision in Malatesta's case might have been rare, but instances of birth trauma are not, public health experts and pregnancy advocates told ABC News. I've heard thousands of these stories. I bet anywhere there's, you know what, I'm not going to say it. There's a lot of gaslighting that goes on when anybody has anything to say about their birth or other than it was beautiful. Why would you say it was beautiful? It was wonderful. Really? Didn't look like you were having fun. It was great. Why? But the bottom line is mistreatment is not necessary for safety. No shit. You're all a bunch of regular Captain Obvious. Captain? In words today. Kimberly Turpin? Is that what she's wearing, or is that her? Okay. Of Los Angeles, whose traumatic 2014 hospital delivery of her son has more than 1 million views on YouTube, said each woman's experience is unique. She filmed the delivery on YouTube. A lot of obstetric. God damn it! I'm done. I can't do words anymore. My brain hurts. I just did a lot of writing today, and I can't do it. Anyways, until next time.